Tetanus. Pharmacological experience has increased as the required studies on diseases are done. The idea that a person who manages to hunt their prey with pointed pieces of rock in their hands will achieve everything when they desire has shown itself very beautifully to modern people in historical research. People who study historical time periods will have to research the Stone Ages after the Stone Age. People have started to do their work with hardware now, and life has become so-called easier. However, tetanus, a disease factor that has probably been seen a lot after the Middle Ages, as well as people who have died from plague and cholera within time periods, has also started to be treated more strictly within the 100-year-old concept of medicine. You might think, is metal necessary for the tetanus microbe in any case? Of course not, but an injury or damage that will occur in the individual is required. This has emphasized the need for a person who has entered a race to keep up with modern times to increase their work and to be taken into consideration more because of statements such as getting more wounds and bruises during these studies. The disease called tetanus is caused by a type of anaerobic bacteria which is Clostridium tetani. For anaerobic bacteria to live, an environment where there is no oxygen is necessary. This bacteria, which is typically found in animal feces, can be found on the dirt surface and in practically all environments. However, to harm body, it needs to enter the body as a result of an injury. When this bacteria enters the body, it secretes a substance called tetanospasmin that has a toxic effect. This harmful substance, directly affecting the muscles and nerves, generally causes expressions that result in death. The incubation period of the bacteria called Clostridium tetani is around 2 to 14 days. The treatment is difficult when it gives symptoms. In the treatment, antibiotics for disease and tetanus immunoglobulin are administered. The important thing is that the vaccine administered as a precaution for today has a very protective role. In our country, the disease can be prevented with the tetanus vaccine, which is free of charge. Especially against the risks that may occur during childbirth, the mother is vaccinated before giving birth. With the vaccination, protection is provided by antibodies transferred to the child. Precautions can be taken in this way against neonatal tetanus. On the other hand, the child's umbilical cord must be cut under sterile conditions. Precautions can be taken with the vaccine administered at certain time periods in childhood. After this period, precautions can be taken with vaccination to be done every decade as a booster shot. Among the symptoms of tetanus, nape and neck stiffness, swallowing difficulty can be said. Other symptoms include fever, sweating, and muscular contractions. If an individual has been injured, whether this wound is small or deep, he should definitely go to a doctor. One should not forget that human life is sacred and its value cannot be measured by anything.